Hey guys, welcome back to the channel, Dr. Cattle Vet. If you haven't subscribed as yet, hit the subscribe button. Also leave a like, leave a comment on the video. Today we're going to be talking about skin disease in dogs. Now, just what do the vet check for? What does it look like, how to test for it? Most skin disease start with a regular dog and it starts itching. So today we've been called out for a little bit of itching. Merc is going to volunteer. If you look here, you can see a big rash on the foot and on the abdomen region. So when you have with some skin disease, there is no itching, but you can see there's such clear borders here. I'm going to show you in another one of the dogs, because with a fungal infection you normally have a dark inside and a clear border, but with this skin disease you can see a lot of secondary changes, also known as lichenification. I'll put the spell in there. So one of the ways to diagnose skin disease, besides looking at it on the shape of the lesion, you can take hair follicles from the border between the normal skin and the affected area. You can also take a skin scrape, and by a skin scrape you will take a scalpel blade, scrape some of the tissue around here, put it under the microscope to see what is there. And if you suspect something like a deep mite, you can do a deep skin scrape, which take further on. It has to bleed if it's a deep skin scrape. So although I came here to check the skin, I always do a full clinical exam. Check the eyes, the ears, the nose, the mouth, everything. I'm going to be doing a series of videos soon on what to look for on your dog, what do vets check for. So remember, subscribe to the channel, click the notification bell to see when they come out. So with itching you can see a lot of secondary changes. But these lesions here come in a little closer. So if you look closely, and there's a better one in another one of the dogs, but it's a circular lesion, clear borders, you might see some crusting. So what I'll actually do, I'll take a sample from the border to have a look, and you can send this for testing if you're going to do follicles, for testing, for fungal testing, as well as if I'm doing a skin scrape, I will do it from by the border. You can treat fungal skin disease a variety of ways. We're going to treat with antifungal tablets for internal treatment, which will be around a month of treatment. Sometimes we may go for longer than that. We'd also use a topical shampoo with a bathing or a washing regime. Yep, it'll be on